ठीक। The macroscopic anatomy or gross anatomy of the kidneys. First of all, the location of the kidneys. These are the retroperitoneal organs, means they are only covered on its anterior aspect by the peritoneal covering. So they are known as the retroperitoneal organs, lying at a level of vertebral level T12 to approximately from T12 to L3 vertebrae. The right kidney lies slightly lower as compared to the left one because of the presence of the liver on the right side. Each kidney is about 10 centimeters in length and 5 to 6 centimeters in width. Related to the coverings of our protections of the kidneys, there are 4 coverings of the kidney. From inside to outside, they are the most inner one, known as inner layer, is formed by the fibrous capsule known as renal capsule, that is towards the renal cortex. That is the outer part of the kidney known as renal cortex. Renal cortex is covered by a layer of the fibrous capsule known as renal capsule, the most inner one layer. Outside this layer, there is a layer of the fatty connective tissue forming the middle layer known as perirenal fat. Then outside this layer, there is a renal fascia that is an extension of the fascia transversalis of the abdomen, and it covers the kidneys and forming the renal fascia, that is the third layer. Then the outermost layer, again, there is a layer of the fat known as pararenal fat. So from inside to outside, there are 4 layers. The first one is the renal capsule that is composed of the fibrous tissue. Then outside this layer, there is a layer of the fatty tissue known as perirenal fat. Outside this perirenal fat, there is a layer of the fascia forming the renal fascia. And outside this layer, there is a pararenal fat. See in this figure, that is location of the kidneys. On the posterior abdominal wall, it is a retroperitoneal structure, lies behind the peritoneum, and these are the different coverings of the kidney. The most close or innermost layer is formed by the renal capsule, that is a type of the fibrous capsule, this blue color layer. Then outside this layer, there is a perirenal fat, a layer of the fatty tissue. Then the renal fascia and the pararenal fat that mostly lies on the posterior aspect of the abdomen. Each kidney has 2 surfaces, an anterior surface and a posterior surface. There are 2 margins. This surface is known as anterior surface, and on the posterior wall, there is the posterior surface of the kidney. There are 2 margins. This is the medial margin towards the hilum, towards these structures, that is the medial margin of the kidney, and this one is the lateral margin. The lateral margin is convex in shape and medial margin is concave, that contains the structures present at the hilum of the kidney. And there are 2 poles, the superior pole and inferior pole. The superior poles of each kidney is related to the suprarenal gland, also known as adrenal glands. So these are the different features of each kidney: 2 surfaces, anterior and posterior surface, 2 margins. Lateral margin is convex and its medial margin is concave. On its medial margin, there is the hilum, from where the structures enters or leave the organ. And there are 2 poles, the superior pole and inferior pole. On its superior pole, there is suprarenal gland. On the medial margin, here is the hilum of the kidney, that is the space within the hilum known as renal sinus. In the hilum of each kidney, the vessels, ureter, and nerves either enter or leave the kidney. But there is a specific arrangement of these structures from anterior to posterior side. The first anterior structure is renal vein. Posterior to the renal vein is renal artery, then ureter, and then there is a third branch of the renal artery. So it is denoted as VAUA. the renal vein, the most anterior structure, then renal artery, then ureter, and the third branch of the renal artery. So that is a specific arrangement that helps in the identification of the side of the kidney, that is right sided kidney or the left sided kidney. See in this figure, the arrangement of the structure at the hilum of the kidney. The first structure, most anterior structure is the renal vein. Then this one is the renal artery, and the most posterior structure is the ureter. After that, another structure is the third branch of the renal artery. But these are the three main structures: renal vein, because it is the left-sided kidney, so it is left renal vein, left renal artery, and here is the left ureter. So this arrangement is important, from anterior to posterior or from posterior to anterior. Now on sagittal section, that is this figure shows the internal features of kidney. The kidney is basically divided into two parts. Its outer part is known as cortex and the central inner part is known as medulla. So this part is known as, outer part is cortex, and this inner part is known as medulla of the kidney. From the cortex, the columns enters, invaginate into the medulla and divides the medulla into the pyramidal shaped structures known as renal pyramids. So these are the cortical columns or renal columns, invagination of the cortex into the medulla, and by this invagination there is a division of the medullary part of the kidney into the renal pyramids. The renal pyramids are cone-shaped medullary pyramids or renal pyramids. So that is the internal structure of each kidney. It is divided into two main parts, the renal cortex, the outer parts, and the central part is known as renal medulla. This cortical parts, there is an invagination into the medulla, and these invaginations known as renal columns. The renal columns are the cortical invaginations into the medulla, and with the help of these renal columns, the medulla is now divided into renal pyramids. Each renal pyramid having a base and the apex. The base is towards the cortical region, and here is the apex that faces towards the hilum, and it enters or opens into the minor calyces. So the apex of the renal pyramids projects into the minor calyces. 2 to 3 minor calyces unite to form the major calyces. 3 to 4 or 4 to 5 major calyces opens into this dilated part of the ureter known as renal pelvis that continues into the ureter. Again, this figure shows the main internal features of the kidney. The cortical part, this is the cortical region known as cortex. This one is known as medulla. Medulla contains multiple pyramidal shaped structures known as renal pyramids. Renal pyramid contains a base that is towards the cortical region, and here is the apex. The apex of each renal pyramids opens into the minor calyces. 2 to 3 minor calyces unite to form the major calyces, and these major calyces then opens into the renal pelvis. The renal pelvis is defined as it is the upper dilated part of the ureter that inferiorly continues with the ureter. Now the relations of right kidney and the left kidney, because there is a difference of the relations of both the kidneys because of the difference in the structures lies on the right side of the abdominal cavity and the left side of the abdominal cavity. So first of all, the relations of the right kidney. Anteriorly, the right kidney is related to suprarenal gland. On the right side, there is liver, second part of the duodenum, and right colic flexure. The structures in the anterior relations of the right kidney. Here is the right kidney. So the right kidney is related to suprarenal gland. The right suprarenal glands, it lies on its superior pole, but it's also projects anteriorly. So in the anterior relation, the part of the right suprarenal gland, here is the lobe of the right lobe of the liver. second part of the duodenum, and right colic flexure, also known as hepatic flexure. That is the part of the large intestine when the ascending colon continuous with the transverse colon and it forms a flexure or turn known as the right colic flexure because it is related to liver, so it is also known as hepatic flexure. So these are the four relations of the right kidney: the suprarenal gland, liver, second part of duodenum, and right colic flexure. Posteriorly, the right kidney is related to diaphragm, the 12th rib, three muscles of the posterior abdominal wall, the psoas muscle, quadratus lumborum, and transverse abdominis muscle, and three nerves, the subcostal nerve, iliohypogastric, and ilioinguinal nerves. Now see in the figure, the posterior relations of the right kidney. Right kidney is related posteriorly to the diaphragm. 12th rib is not shown in this figure. Then three muscles, the psoas muscle, the part of the psoas muscle, quadratus lumborum muscle, and transverse abdominis muscles. And three nerves, the subcostal nerve, iliohypogastric nerve, and ilioinguinal nerve, because these nerves runs on the posterior abdominal wall, so they are lying in the posterior relations. Now, relations of the left kidney. The left kidney is anteriorly related to left suprarenal gland. Then the structures on the left side of the abdominal cavity like spleen, stomach, pancreas, left colic flexure, and coils of the jejunum. Now see in this figure is the left kidney. The left kidney is related to anteriorly left suprarenal gland. The stomach that is reflected in this figure. This is the part of the pancreas, spleen, left colic flexure, and here there is a coils of the jejunum or coils of the small intestine. Posteriorly, almost the same structures are present on the left side and the left relation, posterior relations of the left kidney, except there is a difference because the left kidney is slightly upper side as compared to the right one. So in the posterior relation, there are 11th and 12th ribs as compared to the right kidney, which only related to the 12th rib. All the other relations are same, like diaphragm, three muscles of the posterior abdominal wall, psoas muscle, quadratus lumborum, and transverse abdominis, and three nerves, the subcostal, iliohypogastric, and ilioinguinal nerve. Only there is a difference in the ribs, relations with the ribs. The right one is slightly lower, so it is only related to the 12th rib, and the left one is related to 11th and 12th ribs. Now, the arterial supply of the kidneys. The kidney is supplied by the renal arteries. There are two renal arteries, the right and the left renal arteries arises at the level of the second lumbar vertebrae from the aorta. From the abdominal aorta, first of all, there is an origin of the renal arteries at the level of second lumbar vertebrae and right and left renal arteries. Now, each renal artery at the level of the hilum, when it enters into the kidney, it divides into 5 segmental arteries. Here is the renal artery. When it enters into the hilum, it divides into 5 segmental arteries. Now, each segmental artery then give rise to lobar arteries for each lobe, like inferior lobe, then middle lobe, then posterior lobe, superior, lateral lobe, superior medial lobe. So they are related to the lobes. These branches are known as lobar arteries. From the segmental arteries, there are multiple lobar arteries arises. Then each lobar artery give rise to interlobar arteries. These are the interlobar arteries that runs on the sides of each pyramid. This is the pyramid. These interlobar arteries runs on each side of the renal pyramid. Then these arteries forms an arch and known as arcuate artery. In the junction of the medulla and the cortex at the level of the base of the renal pyramid, these arteries forms an arch known as arcuate artery. From the arcuate arteries, multiple interlobular arteries arises which runs into the cortical region. From the interlobular arteries, there are numerous efferent glomerular arteries arises and enters into the glomerulus and forms the glomerulus, the tuft of capillaries in the nephron. So that is a flow chart for the arterial supply of the kidney. From the aorta arises the right and the left renal artery. Each renal artery at the hilum of kidney divides into 5 segmental arteries. From the segmental arteries, multiple lobar arteries arises for each lobe of the kidney. From the lobar, it gives rise to interlobar arteries that runs on the side of the pyramid, renal pyramids. The interlobular arteries forms an arch structure, so it is known as arcuate artery, present at the junction of the cortex and the medulla. From the arcuate artery arises interlobular arteries that runs in the cortical region. From the interlobular arteries arises the efferent arteriole that give rise to the glomerular capillaries. That is the arterial supply. Now corresponding veins drains the kidney. From the glomerulus, it will form the efferent arteriole that enters and forms the peritubular capillaries and vasa recta. These capillaries then drains by the interlobular vein. The interlobular vein then will form arcuate vein. Arcuate vein enters into interlobar veins. From the interlobar, either they directly enters into the renal vein or through the segmental vein enters into the renal. From the renal vein, the blood drained by the inferior vena cava. That is an important topic related to the structure or anatomy of the kidney, the vasculature of the kidney or blood supply of the kidney. Then the lymphatic drainage of kidneys. The kidneys are drained by the lateral aortic, also known as lumbar group of the lymph nodes. The nerve supply of the kidneys arises from the renal plexus that contains both the type of the fibers, the sympathetic and parasympathetic fibers. They runs in the form of plexus, and these plexus known as renal plexus. Now, some of the clinical points related to the gross anatomy of the kidney. First of all, the palpation of the kidneys. Usually, the kidneys are impalpable structures because they lies on the posterior abdominal wall, but in thin, lean adults, only the inferior pole of the right kidney is palpable because right kidney lies slightly lower than the left one. So its inferior pole may be palpable by a bimanual examination. Bimanual examination means an examination with 2 hands. The palpation of the right kidney is possible because it is 1 to 2 centimeters lies inferior to the left one. To palpate the kidneys, press the flank region or the side of the trunk. See in this figure, at the lumbar region, slightly press with the right hand. And posteriorly, there is an left hand that lies at the level of the iliac crest. The right hand lies at the level of 11th and 12th ribs. By palpating with the right hand, by applying a slight pressure with the right hand, you can feel only the inferior pole of the right kidney. The left kidney is really impalpable and it's only palpable when it is enlarged in different cases related to the kidneys. So that is an bimanual examination to palpate the kidneys. Another important clinical condition associated with the kidneys are the renal stones or renal calculi. They are usually composed of the salts of the inorganic salts, organic acids, or with the other material, calcium salts, calcium stones, phosphorus stones. There are different types of these stones that lies iron forms within the kidneys. They may be formed and becomes located in the calyces of the kidneys within the minor calyces or into the major calyces, or they may pass from the calyces and enters into the renal pelvis, and inferiorly they move down into the ureters and goes towards the urinary bladder. The pain of the renal calculi usually referred to the cutaneous areas that are innervated by the spinal cord segments from T11 to L2, because the sensory pain fibers enters at these levels of the spinal cord. So the pain is usually refers to the cutaneous area supplied by the nerves from T11 to L2. Another clinical condition known as renal cysts. Cysts are usually common conditions related to the kidneys, and a condition known as adult polycystic disease of the kidneys is an important cause of renal failure. It is inherited as an autosomal dominant disorder. In this condition, there is formation of multiple cysts in the kidneys that leads to the renal failure. So these are the important points related to the gross structure of the kidneys. First of all, its location, then its length and diameter. The coverings are important. There are 4 coverings from outer to inner side, or from inner to outer side, and they are also providing protection to the kidneys and held the kidney in their position by these coverings, along with the structures that are lie at the level of hilum. These vessels and ureter, they also supports the kidneys and they place the kidneys in their normal position. Then the structures present at the hilum of the kidney, they are important along with their specific arrangement from anterior to posterior side. This arrangement is important. The most anterior structure is renal vein, then renal artery, and then the ureter. On the internal structure, first of all of you should know about the 2 regions, main regions, the cortical regions and the medullary region. What are the structures present in the medulla? They are known as renal pyramids. Then they are drained by the minor calyces, major calyces enters into the ureter. Important relations of the right and the left kidneys. These questions are related to your OSPE. After the identification of the kidney, the second questions may be related to the relations of either right or the left kidney. Then blood supply is also important, and a few clinical correlates. जी प्रांजल.
मिस हाइलम की अरेंजमेंट में आपने बताया कि पहले वेन आती है, फिर आर्टरी, फिर यूरेटर, फिर से आर्टरी. तो 2 आर्टरीज हुई ना, फिर आप थर्ड ब्रांच ऑफ आर्टरी भी बोल रही थी.
तो ऑलरेडी वो दे चुकी हुई होती है.
अच्छा,
जब वो एंटर हो जाता है तो ऑलरेडी 2 आर्टरीज हैं वहां पे. तो जो थर्ड है ना, वो मोस्ट पोस्टीरियरली चली जाती है एट द साइट ऑफ द हाइलम.
वो पिक्चर में आप दिखा सकती हैं?
वो इस पिक्चर में नहीं नजर आ रही.
ठीक है
जी. यहाँ पे एक्चुअली मेन आर्टरी है और बिल्कुल पोस्टीरियर जो है ना एक ब्रांच है. इसी तरह से ये अपीयर होगी कि ये मोस्ट पोस्टीरियर स्ट्रक्चर हो जाती है. यहाँ पे नहीं नजर आएगी इस फिगर में ये आपको. Any other question related to the gross anatomy of the kidneys?